We are live. Please go ahead.
Okay. Thank you, IT team ASSOCHAM. I am DS Rajora from ASSOCHAM. So, a very good afternoon to everyone. It gives me immense pleasure to welcome you all to this ASSOCHAM's webinar on investing in adolescent nutrition and health, a call for action. Let me take this opportunity to welcome you and our special guests and the panelists to this session. I welcome Madam Inusi Sharma, Executive Director, FSSAI, Mr. Arun Lal, Senior Vice President, Hexagon Nutrition Limited, Madam Deepti Gulati, Industry Chair, Professor, Nutraceuticals and Fortification of Staples, Dr. Agatha Besti, and Senior Specialist Nutrition, Modeling International, Dr. Siddharth Vaglukar, Nutrition Officer, World Food Program India, Mr. Devraj S.K., Deputy Manager Nutrition, Akshay Patra Foundation, Madam Shilpa Joshi, Director, Mumbai Diet Clinic and National Vice President, IDA, Madam Megha Mandke, Assistant Manager Technical Marketing, Hexagon Nutrition Limited, and our moderator for the technical session, Madam Rinka Banerjee, Founder and Director, Thinking Folks Consulting. I also welcome all the panelists to this webinar today. It is indeed my pleasure to see intellectuals involved for the context of this nutrition subject and to discuss and develop strategies to address the constraints which are prevailing to this. Ayurveda claims food as a source of not just nourishment but also assert food as an embodiment of life force. And then the old saying becomes meaningful: what we eat, we become. It is noticeable and very well comprehended that what a nutritionally deficit diet can cause to an individual. It is understandable that not to consume a nutritionally rich diet is to risk our health and vitality. Eating a food is important, but eating a nutritionally rich, balanced diet is necessary. So the need of the hour today is to build capacity within the public sector and to improve the center-state coordination to implement better procurement and distribution models for fortified foods. Providing fortified foods in midday meals, supplementary nutrition in Anganwadi centers, and using public distribution system can be some of the major channels that can be leveraged to address the issue of hidden hunger in rural areas. Platforms such as self-help groups can be used to create awareness and to cook meals using fortified staples. With this deliverance, I am sure that this will be a thought-provoking discussion and would require engagement from various stakeholders. So now I request my colleague Aina to take the discussion forward. Thank you so much.
Good afternoon, everybody, and I would like to now welcome Mr. Arun Lal for his special address. Mr. Lal is the Vice President of Hexagon Nutrition Private Limited and has demonstrated history of success and achievement in consumer and nutraceutical industry. He is skilled in strategizing business objectives and goals, team motivation, team leadership, and team coordination. With over 3 decades of experience in consumer goods and nutraceutical industry, Arun sir has been built brands like Himalaya, Evian, Morphy Richards, Jockey, and Hexagon Nutrition. How can we forget? Focusing on enriching food, nutrition, food fortification, and malnutrition, he has also been honored as the best healthcare entrepreneur by the World Health Congress. With these words, I would like to welcome Arun sir for his special address, please. Arun sir, you are on mute. Kindly unmute yourself, please.
Am I audible now?
Yes, sir. Please go ahead.
Great. So thank you very much, Aina, for the wonderful profile which you've spoken about me. Good afternoon to one and all. At the onset, I would like to thank ASSOCHAM for organizing this important webinar on investing in adolescent nutrition and health, a call to action. So let me begin with some statistics. India is home to about 250 million adolescents of the age of 10 to 19 years. They constitute about 20% of our total population. Thus, it is very crucial for us as a nation to focus on their health and well-being and provide them with the resources for their optimum growth and development. So by doing so, we will ensure social and economic development of our country in the future. I believe all of us have a collective responsibility to ensure this. So adolescence is also a nutritionally vulnerable phase when one goes through a rapid physical growth coupled with increased nutrient demands. Prevalence of undernutrition among adolescents is a significant public health concern. India's comprehensive national nutrition survey shows that between the ages of 10 to 19 years, the prevalence of undernutrition stands at an alarming rate of 28.4%, which is relatively higher. According to NFHS 5, the report which they have come out with, 59% of adolescent girls aged between 15 to 19 years are anemic. Anemic among adolescents impacts adversely impacts growth, increases the chances of their getting infection, and impacts cognitive development and productivity. In India, through the government, we have been running schemes for provision of weekly iron and folic acid supplements, biannual deworming. Also, adolescents are provided with nutrition counseling to improve their diet and prevent anemia. These steps are commendable, but we need more resources to ensure optimum health status for our adolescents. And I firmly believe that the private sector must set up now to play its part in its direction, as it has been correctly stated by Coretta Scott King that failure to invest in youth reflects a lack of compassion and a colossal failure of common sense. And I can say that public-private partnerships are pivotal for combating nutrition and food security challenges of the nation, thus impacting its future. So one of the major roles which private companies can play, companies like us can play to overcome adolescent malnutrition, is creation of healthy food products using nutritious ingredients. Creating awareness and demand for such products is another role that the private sector can play. Creation of products specifically targeting a malnourishment issue could also be of great help. While private entities in the food sector could produce products addressing malnutrition, these can also be distributed more efficiently via the PPP model. Collaborations are critical in making these products accessible for everyone. Private sector has the technical knowledge to leverage economies of scales, increasing the success of such programs, and that is what is happening in today's era. Post-pandemic, it is the private sector which is moving ahead, and thanks to the regulations brought in by FSSAI, most of the food applications are now coming into the compact of FSSAI and the RDA levels set up by them. So this is a positive sign coming in towards good food and nutritious food being bought in by the private sector. Another major thing, thanks to the government and FSSAI, is fortification of staples and condiments with essential elements, with essential vitamins and minerals, is a cost-effective strategy that can help us in combating micronutrient prevalence in adolescents. There is provision already in place for fortification with reference to wheat flour, rice, salt, edible oils, and milk, with B vitamins and iron, vitamin A, and vitamin D. The partnership can support sensory evaluations, which can facilitate faster acceptance of food fortification and allied schemes for addressing malnutrition and promoting food security. Even though public-private partnership have a lot of potential, it is also important to understand there are some principles, ethical principles to make them successful. I strongly believe that's my personal thing. Ethical principles have to be there very much. I would like to share some recommendations to strengthen public-private partnership for adolescent health in resource constrained settings. Well, these are based on a study published in The Lancet and are based on formative qualitative inquiry with a range of stakeholders encompassing government, healthcare providers from both the public and private sectors, NGOs, development partners, relevant UN agencies, and youth advocates. The study is not set in India, but the recommendations are definitely worth noting for the Indian population. Second, it recommends such partnerships would be led by the government itself. However, there was also the recommendation that development sectors and NGOs may play a very important role in conveying and leadership. It also states that access to training, licensing, accreditation, and professional development is also crucial. Well, in my eyes, before I close in, supplementation and food fortification are some of the most effective strategies to overcome dietary shortfalls. And public private partnerships are an opportunity to meet the nutrition challenges so that we all can make the nourish and the health and healthy India a reality for the future. Thank you very much. And over this, we start our participation by our esteemed speakers. And I'm going to listen to each and every speaker and the panelists and then judge it out. Thank you very much, friends. Thank you very much for listening to me.
Thank you so much,
Over
Arun
to
sir,
you,
for
Aina.
thank you so much, sir, for setting the tone for this session. And now I would like to welcome our chief guest for the session, Miss Inoshi Sharma. And as everybody knows, Inoshi ma'am is an officer of Indian Revenue Services. She has held various assignments pertaining to publicity of tax provision, international taxation, vigilance, and tribunals. She has led teams for enforcement of tax laws and ensuring tax compliances. She has worked as Director, National Health Mission in Haryana, looking after procurement of drugs and equipment, adolescent health, medical screening of children of up to age 19, and programs pertaining to menstrual health and weekly iron folic acid supplementations. Her current assignment as Executive Director FSSAI involves social behavioral change and communication and extending support to scaling up fortification across the country. She has an interest in public policies, administration, and social sector. With these words, I would like to welcome Inoshi ma'am, and I would share the presentation from my end, ma'am.
Thank you so much. And I would, of course, like to thank ASSOCHAM for inviting me for this particular meeting. As part of the Eat Right initiative, we like to, talk about how eat right habits, which just don't include about the food that we are having, but also the safety issues which are surrounding it, as well as the sustainability issues are also something that we really want to emphasize on. And adolescents, as has been discussed, are an amazing part of our population because they're at an age group where they're neither children, neither adults, but they are the future of the country, and their health actually is what would determine what kind of a future are we going to have. So I actually made this little short presentation so that it just doesn't get too boring listening to my voice. Next, please. And what I really wanted to talk about is how in the Eat Right initiative, some of the things that we talk about, as part of Eat Right, what are the things that we probably talk about? So it's good nutrition, regular physical activity, food safety. A lot of times, even as young people go out and eat, after school or college, and if they are having food which is not safely made, they'll fall ill. Foodborne illnesses are bound to happen. How, we can make sure that it doesn't happen, they're sensitive to it. Cleaning hands before eating, sanitizing them. Personal and environmental hygiene actually takes care of that. Adequate sleep and optimum water intake. These are broadly the 6 things that we really focus on and which adolescents are not taking care of. Next. So, of course, we need food to be active, build new cells, also heal ourselves and prevent and fight infections. Now, this is the time when adolescents are suddenly having a growth spurt. So, their need for protein, vegetables, vitamins, all your micronutrients, it's really high. Next, please. So this is the time also when we find adolescents, if they've not eaten food properly, if they're eating too little, they're undernourished. If they're eating too much, they're overnutrition, so they may become obese. And if they're not eating a balanced diet, they'll have bound to have micronutrient deficiency. Next, please. And this goes on. And if this deficiency is there during the adolescent time, it's next, please. It spans for a large number of time. So what we find is that a lot of times there is deliberate reduction of food consumption, because this is the time when sometimes because of peer pressure or sometimes even relatives can be very mean, parents become very unconscious and making very sarcastic remarks to their children. So they start reducing the consumption of food. A lot of kids wake up late because they've slept late, they won't have breakfast, or they'll skip a meal. Then they end up consuming too much of food which is high in salt, fat and sugar. There's a absence of fruits, vegetables, pulses in meals. A lot of parents complain our kids don't eat fruits or vegetables or pulses. What do we do? And some of the factors leading to it are advertisements, peer pressure, body image, sometimes the lack of time to cook a healthy meal by the parent. There's decreased physical activity, which we saw during the pandemic, and watching TV while eating. Next, please. So, what we really want to focus and make sure a child is having, and since a lot of people here are present from the FBO side as well as from the development partners, how every time we are projecting a food, we make it part of a wholesome diet, and we ensure that our children are having, or our adolescents are having, cereals, grains, then pulses, milk products, or non-vegetarian food if they're having fruits and vegetables, and cutting down on fats and sugars, having, not eliminating, that's why I said, but having a very restricted amount of it. Next, please. So this is the food pyramid that all of us have gone through in our school, and we've all been taught how energy giving foods should be taken the most, then the protection foods, the bodybuilding foods, the energy giving food. But usually what happens is we consume more of the energy giving food, we cut down on the energy giving food in the name of diet, and we definitely otherwise totally avoid protection food and bodybuilding food. Next, please. No, actually, I wanted to add bodybuilding food is something that some of the adolescents have got obsessed with. So, for those who've suddenly developed this idea of having a great body, they only want to have proteins, not realizing that you actually need to have everything else also. So keeping yourself hydrated is also a very, very significant thing. And a lot of people forget that why water, having, adequate amount of water is so important, not just for cleansing of the body, but keeping it hydrated, especially in a tropical country like ours, and also avoiding false hunger pangs. Next, please. So there are a lot of go fruits, glow fruits, and there are the grow foods. So what we generally try to say in Eat Right is please have this, and not just adolescents, even adults, even small children. Everybody should try to have all these meals in all their meals, all these broad categories of foods. Next, please. So, if we look at the nutritional status of adolescent girls and women, we find that in India, of course, with the NFHS data also, it's quite poor. So, almost 50% of them are anemic, and which also means that during pregnancy there is low height and weight, and you can't support a healthy fetal growth. And therefore, it becomes so much important that when they are young, when they're adolescent, they start taking care of their reproductive health, and that will only come when you are eating properly. Next, please. So this I've already mentioned, that how being physically active is so important, and physically active could be any form of an exercise, could be a dance form, anything which a adolescent finds creative, and making sure that you get 7 to 8 hours of sleep. Next, please. So these are, how anemia happens, and a lot of times adolescents feel tired, they have breathlessness, there's lack of concentration, there's loss of appetite, increased chances of falling ill, and infections. These are all because of this particular condition where there is deficiency of hemoglobin in the red cells. Next, please. So again, it can easily be prevented if adolescents are made to have a balanced diet and foods which are rich in leafy vegetables, green, whole grains, jaggeries, and nuts, and of course, adequate supply of vitamin C to the diet. Next, of course, consuming fortified staples helps, and that's exactly what the government's program in the ICDS, MDM, and PDS is going on. Of course, a lot of people have misconception that it is plastic rice, or it's rice which is mixed with something, or it is coming from a particular country. So generally, a lot of awareness needs to be created among people that no, it is actually good for health, and its regular consumption actually helps you fight micronutrient deficiency. Next, please. A lot of times what we've seen is that people are eating even if they're not hungry, or they have a screen in front of them. It could be your laptop, the TV, the mobile. And sometimes parents do the mistake of making a food as a prize. So if you're providing a food which is high in salt, fat, sugar as a prize, then the regular food which actually should be eaten becomes boring. So this is something that, counseling of parents needs to be done. Even in advertisements, you see that maybe a particular thing is like a reward. Those are things which actually then lead to, just glorifying certain food product categories and then sidelining the others. Next. I'm eating a balanced diet, but I'm still falling sick. And the reason is because insufficient personal and surrounding hygiene. Next. In FSSAI, because we really focus on food safety and hygiene, this is something that really needs to be, ingrained among adolescents, because they've reached a stage where they don't really want to listen to you. They're no longer kids. They feel they've grown up. But is personal hygiene really being followed? Now that needs to be emphasized, because even if I'm having home cooked balanced diet, but my hands are dirty and I'm eating it and I fall ill, all the benefit of that food is not going to be, absorbed by my body, and I'm just going to be weak anyway. So that is something that really needs to be taken care of. Next, please. This is just about Wash in School, the program that the government has regarding clean drinking water, sanitation, and hygiene. Next, please. We have in FSSAI created yellow books, and in that we have these exercise sheets, which are till, the yellow books are available up to class 8th. And there are these beautiful little activity sheets where, young children and adolescents are taught about how, food safety, personal hygiene, cleanliness can be maintained through these little activities, just one pager activities which can easily be adopted by schools. Next, please. Then again, this is another thing which is done. Part of the activity sheets which are done. So these are some of the creatives that we made, we put out on social media. Again, these are little things which I don't know if the school community is here, but they can be adopted. And like, I'll tell you, my kids are both in a leading school in Delhi, and I have not once in the WhatsApp group for parents found any message on food safety, hygiene, a balanced diet. Either it's a good morning or it's some sort of a forward. But why is it never a forward on something like this? Because as parents, we are always concerned about these issues. So this is something that maybe we can encourage. Next, please. Now, reading food labels while buying packaged food is something that, we will be focusing at FSSAI in the coming months, because we want adolescents and then young people at a very early age to determine how to read labels so that you get to know what is the composition in terms of fat, salt, sugar, as well as if you have any allergens. Do you have allergies, and can you find it in the product? How do you see it? So those are things again we want people to see, and particularly the FSSAI logo, because sometimes there may be products which are not registered with us. A lot of you must be aware that in 2020 we came out with the Safe Food and Balanced Diet for Children regulation, which actually prohibits the sale of foods which are high in salt, fat, and sugar in the school premises and 50 meters from the school gate. Now, this would also ensure in the long run that children in the school are not having this kind of food. So, what is really important is teaching children early about how to handle and prepare food safety tips to create a new generation of healthy consumers. Next, please. So, this is just our Twitter, Facebook, Instagram, and the YouTube channel that we have, and our websites. I would request all of you to please visit us here. You'll get a lot of information. So, with that, I would like to end here. Thank you so much.
Thank you so much, Enoshi ma'am. With that, I would like to welcome our moderator for today's session, Ms. Rinka Banerjee, and kindly take over the technical session, ma'am.
Hello, can you hear me?
Yes, ma'am.
Yes, we can.
Yeah, hi. Hi, I'm Rinka. I'm the founder of Thinking Folks Consulting, and we work with essentially the food industry where we help them develop products and help them bring it to market. So nutrition is very close to us, and I think this is a fantastic opportunity. And thank you, ASSOCHAM, for giving me the opportunity to moderate this session for you. I think already Ma'am Enoshi has already told, and Mr. Arun Lal has already told about the whole importance of nutrition for adolescents. And I think as they flourish, I think it's also our responsibility to ensure that, our adolescents in the country are today getting a very balanced kind of a diet. And like you rightly said, that, the whole, the environment is changing so much. And I know I'm a mother of 2 teens, and I know how difficult it is to get them to kind of, eat healthy. Yeah. And I think one of the things with teens today is, they are making their own decisions and making their own choices in terms of the food that they want to eat or they want to buy. And it's no longer that the mother goes to a store and picks up a food and says, have this. They will go, they will buy it, they'll buy it online or whatever, and, make a choice that this is. And so therefore, how do we help them make healthier choices? And I think that's something that's, we need to think about. The fact is also COVID-19 has been an interesting time for, obviously, everyone's working online. Kids are not going out and playing as much as they should. Sort of a lot of people, a lot of the kids being addicted to their gadgets, stuff like that. That's, of course, leading to a lot of other problems. Because of that, I think from the industry perspective, one of the trends we've seen is a massive snackification of meals. Yeah, so people are eating less amount of meals, like the whole square meals, and having more snacks, maybe a sandwich, maybe a bag of chips, maybe, a lot of things that they're eating, and therefore you're full and not really eating through, your lunches and dinners as much as they should. So that's on one hand, one problem which is leading to obesity, diabetes, and all kinds of other challenges. On the other hand, which is really about the undernutrition problem, and I think that's a problem still to be solved, where fortification can certainly play a very big role. And I think, like you rightly said, that if I look at all the numbers, if there are, more than 40% girls who are anemic, what was also interesting for me to see is there are more than 18% boys who are anemic. So it's not necessarily a woman or a girl problem. It is also a problem for the boys in the, rural areas, especially, where iron is a big challenge. And several other, nutritional deficiency, and we'll come to that when we talk with the panel. So I think there is a lot to be discussed, and I think what I will do from here is really to introduce you to a really power-packed panel today. And let me just give me a second, and let me just introduce you to the panel. And what we will do is each of the panelists will give their perspectives, and then we'll get down to a few questions. And please feel free to put in your questions on the chat box, and then we will take it from there. So let me introduce you to Dr. Siddharth Vagulkar. He's the Deputy Head Nutrition and School Feeding Unit, United Nations World Food Program. Dr. Siddharth Vagulkar is currently working as Deputy Head for the Nutrition and School Feeding Program at UN World Food Program in India. He is experienced in the field of public health nutrition and has led several innovative maternal and child health nutrition initiatives across the country. His areas of interest are infant and young child feeding, management of children with severe acute malnutrition, food fortification, amongst others. He currently manages the WFP's portfolio on nutrition in the state of Uttar Pradesh. He has worked across government, international, and UN agencies during his experience. And Dr. Vagulkar holds a graduate degree in medicine and master's in public health, specializing in health policy, economics, and finance. I'd like to introduce you to Mr. Tanmay Ghatak, Program Policy Officer, School Feeding for the United Nations, again, World Food Program. Mr. Ghatak is experienced development sector professional with specialization in program management and public policy engagement. He comes with 17 years of work experience in the areas of school feeding, livelihood through skill development, urban planning, and development with special focus on the marginalized population. Mr. Ghatak holds a master's degree in economics from the University of Calcutta. Dr. Deepti Gulati, nutrition and public health specialist, and she is the industry chair professor at NIFTM for nutraceuticals and fortification. She has a rich work experience of 43 years in nutrition and public health. Her effective policy advocacy and augmentation of food industry's capacity to undertake staple food fortification have resulted in reaching over 950 million people with one or more fortified staples. Ms. Gulati has been honored and awarded with Outstanding Ambassador of Nutrition and Food Fortification Award 2020 by ASSOCHAM, and the Lifetime Achievement Award in 2018, Nutritional Leadership Award in 2019, and there are many, many more awards to her credit. I would like to invite Mr. Devaraju. Mr. Devaraju is a professional nutritionist with 11 plus years of experience in the field of healthcare, hospital, and NGO, working as Deputy Manager Nutrition Pan India at the Akshaya Batra Foundation, Bangalore, which is doing an amazing work in the midday meal program. Dr. Agatha Betsy, and she is again worked with Mondelez since 2014. She's trained in nutrition with a master's in nutrition from Isabella Thoburn College, Lucknow, and she's a recipient of the NET and pursued PhD from National Institute of Nutrition. Her area of expertise is in the area of regulatory compliance and advocacy, nutrition claims development and defense, micronutrients, functional benefits requirements, snacking science, and portion control. So it'll be wonderful to hear your perspectives on the regulation aspects of nutrition. I would just 1 second. Yeah. I would like to also introduce to you Ms. Megha Manse and Manke, sorry, and she is currently the Assistant Manager Technical for Hexagon Nutrition. She's a registered dietitian with the Indian Dietetic Association and a certified diabetes educator. She's handled many projects, under the IDA, and she does the nutrition assessment project, and she has done the nutrition assessment project with Foundation of Mother and Child Care in Mumbai. And the other interesting thing that she has done is to write manuals on nutrition for pediatric cancer patients. And I'd be very interested to know a little more on that. I'd like to introduce you to Ms. Shilpa Joshi. She's the consultant dietitian of the Mumbai Diet and Healthcare Center. She is a practicing dietitian and a diabetes educator. She's the honorary secretary of the All India Association of Advancing Research in Obesity and the vice president of the Indian Dietetic Association from 2019 to 2021. And again, she's been somebody who has won many, many accolades and awards in the area of nutrition. So thank you so much, all of you, for joining in today. And as you can see, it is a power-packed panel. What I would like to probably do is to just start off with each of our esteemed panelists, Dr. Siddharth Vagulkar, maybe to begin with, just to give your couple of minutes of your perspectives on this whole area of adolescents, and nutrition and adolescents.
Thanks, Ms. Rinker, and thanks a lot for ASSOCHAM for inviting us to be a part of this panel discussion. And also thanks to the sponsors who've been a part of this. So if I were to sum up, I think the previous panelists, I mean, Arunji, Inoshi, ma'am, they've all summed up the issue and the topic, the gravity of the issue very well. And they've all talked about adolescence, why it's such an important age group. I mean, just to look at, we're essentially talking about the first 8,000 days of life. I mean, we all know the importance of the first 1,000 days of life and how critical they are, and especially in growth and development of the child. If you look at the first 8,000 days, it's just a slight bit of extension from the first 1,000 days up to say 20 years of the child, where you would see, like when we talk about infancy and young children as one of the phase of growth and development, we also see adolescence as one phase where you see another growth spurt or another area where growth and development in the child happens. And especially adolescents could also be looked at in three different phases. Is one when we talk about children 5 to 9 years of age, when there is a possibility of infections, and there is also that growth which is happening there. Then 11 to 14, where another growth spurt takes place, and then around say 15 to 19. So essentially, we're looking at around a period of around 15 to 18 years, where maximum growth, also growth and development can take place. Now, we're all aware about some of the issues which adolescents face. And I'm just going to sum up in just about 1 minute here, is that we're essentially talking about, say, when we talk about diets for adolescents, we're talking about diets which are not necessarily diverse, or, you do not have that adequate diversity in the diets that children eat or these adolescents eat. Secondly, we're also talking about the intake, or whatever the children are or the adolescents are consuming. Again, the intake of these adolescents, again, is not necessarily rich in micronutrients or nutrients per se. So again, the lack of nutrients is something essentially which we can see in most of the diets for adolescents. Then third factor, what we see is awareness that the diets may be rich or may not be rich, or even, you may be having dietary adequacy or not. But again, the awareness that, what is good for me, what is not good for me, or, those are the things which essentially, again, are a gap which you would see in most of the, be it even in areas such as us, or where we work with on large scale food or large scale programs, or else even in private sector, or even in children who are from the private schools as well. So lack of awareness is one issue which we also see. The other factor that we see is food safety and hygiene. I mean, we all know the importance of food and good food. But again, how clean is that food? How good is that food? What are the food safety and hygiene parameters that we've looked upon? So again, this is another issue which we have recognized here, or we recognize this as a very important gap at the World Food Program. And then another parameter that I feel I would like to add is the increasing influence of packed foods or processed foods or foods which are rich in high fat, salt, and sugar. Again, that is something which is leading our adolescents in a way to a spectrum of malnutrition. Like in a nutshell, if you were to look at the malnutrition spectrum for adolescents, we have undernutrition, we have overnutrition, and we also have micronutrient deficiencies. So in a sense, we have some of these gaps in the nutrition space for adolescents as such. And that is where I wanted to bring in as to what we do at the World Food Program. At the World Food Program, we are basically highlighting or identified some of these interventions or some of these gap areas, and we're trying to address it in one by way in each different step altogether. But I'll request my colleague Tanmay to talk about it. Before Tanmay starts, I'll also share in the way we do it. I mean, at the World Food Program, we basically implement pilot to different scale. Pilot to scale up approach. We have different pilots which we implement across in different states. We identify what are the gaps in those particular states, what are the gaps in the public sector programs or even in the private sector programs, what are the gaps and how could we address it. Then we implement a particular intervention. We identify that intervention, and we basically, after implementing that, we also see what are the impact of the intervention, what are the learnings out of that intervention, how did it work, how well did it do. And after that, we also advocate for the scale up with the respective state governments. So this is how we progress towards from a pilot to a scale-up approach. Now, I would request my colleague Tanmay to come in and talk about what are these specific interventions that we work upon and how do we bring upon a change. Over.
Yeah, I would just request Mr. Tanmay to give a very brief overview, and then we will, of course, get into a lot of these details in the questions. But yeah, if you can just give a brief overview, about your perspective on this topic.
Okay, thanks, Mr. Rinka, and to the other panelists. So in World Food Program, what we're doing, keeping in view the importance of the nutrition of the adolescent children, we are concentrating on basically on the 5 areas of intervention through the school feeding intervention. The first thing is that we are working on the fortification of rice and the wheat flour, which are being supplied for under the midday meal scheme, and we have worked since 2012 to 2020. Now it has been scaled up to all the districts by government of India. Second thing is everybody is talking about the maintaining the food safety and hygiene. So keeping that in view, as you all know that there are 2.5 million cook-cum helpers, those who are working in the schools. So we're working on the capacity building of those stakeholders as well, and for that purpose we have developed a mobile app which is called FOSAF MDM app, and the cook-cum helpers are using this app to get the knowledge about the different aspects of food safety and hygiene. Now it is being under implementation on pilot basis in 3 blocks. 2 is in Uttar Pradesh and 1 block is in Odisha, and we are also planning to roll out to the one more block of the Rajasthan. All these are being implemented in association with the respective state governments. Third piece of work that we are going to start, that is the establishing the school nutri garden. As you all know that it has various aspects, that setting up of school nutri garden. It provides the more nutritious vegetables, leafy vegetables to the daily midday meal, and it provides a kind of knowledge about the nutrition and the value of nutrition of the different vegetables to the children as well. The fourth piece of work, which covered the other aspect of work, that is the social behavior and change communication work with the school children and the community, mainly the parents and the school management committee. Here we are broadly focusing on the nutrition and the solution for the preventing and addressing all types of malnutrition and how to maintain good health and personal hygiene. The fifth piece of work that we are doing, that we're providing some policy level support on addressing the issue of overweight and obesity among the adolescents in partnership with Unicef and World Health, WHO. So all these are work, that piece of work that I mentioned, we're doing it on, as Siddharth was mentioning, on pilot to scale up model. So due to paucity of time, I will stop here. I'll again come up with more details. Over.
Thank you so much, Mr. Tanmay. I'd like Dr. Deepti Gulati to just come online and maybe give your perspectives. Dr. Gulati, are you there?
Yeah, sure. I think all my panelists and the speakers have already covered everything in such details that leaves very little for me to say, and they've said it so brilliantly. So all I can do is, a summary thing to say that yes, we are talking about adolescents, and it is a time of change and development for the adolescents because they experience very rapid physical growth. It leads to increase in appetite and nutrient demand. Micronutrient deficiencies amongst adolescents set in because the kind of food that they like to eat and they're eating is not necessarily rich in micronutrients, that is vitamins and minerals, and that adversely affects their growth. It also brings down their resistance to infections. It also leads to poor cognitive development, which they need at this time in much, they're in much need of this cognitive development, and their work productivity also decreases because they love consuming processed foods, which are high in fat and sugar. this trend is rising, and we need to understand that if we are to tackle the nutritional problems in adolescent, we have to be friends with them and explain to them that all the foods which are very high in fat, sugar, and salt, they are very tasty, no doubt. Even I love them, but moderation is the key. They're all junk foods, and no one wants to junk their body. So it is good to have these junk foods or processed foods, but only once in a while, because it often leads to overweight and obesity, which increases their risk of diabetes, hypertension, and other long-term health consequences. We need to engage with adolescents very actively, because adolescence is the age which provides us with the second inning or the critical window of opportunity to correct the nutritional deficiencies that may have occurred earlier, or now because of the food habits, their lifestyle, so that we can prompt them, we can nudge them to catch up on the growth loss and help them to develop, because adolescents do deserve much needed attention, and they hold the key to breaking the entrenched cycle of poverty, inequity, and deprivation. So this is all I would like to say in my opening remarks, and I would be very happy to answer any questions, because anything more than this would be just repeating what my very eminent speakers have said it before me.
Thank you so much. Thank you so much, Dr. Gulati. I'd like Mr. Devaraju to give his initial opening remarks, and having worked in the whole midday meal program, would be great to hear your opening remarks.
Yes, ma'am. Thank you, ma'am, and thank you, ASSOCHAM. Akshay, hello. Am I audible? Yeah.
Yes, sir, please go ahead.
Yes, ma'am. TFPF till now served about 350 crore midday meals and about 1.63 crore Anganwadi meals and about 20.33 crore COVID meals, like COVID relief meals. And we have served food kits of about 17.6 lakhs and family happiness kits like during the COVID time. And apart from that, the major challenges we faced are we are serving Akshay Patra serving midday meal to schools in partnership with central and respective state governments. The preparation and one of the challenges, the preparation and distribution of MDM cost is more than the funds provided by the government. And the second challenge is the grains which we receive from the FCI, the grains, the dalia or the rice or the wheat we receive from the grain, it contain like common infestations like rodent droppings, weevils, whiteworms. Like it adds extra cost for the cleaning. And another challenge is we observed that children are not consuming vegetables because of the lack of nutrition awareness. Because nutrition education is an important element for preventing all forms of malnutrition. So it should be taken into account to our government agencies, NGOs, schools, colleges, universities to share the knowledge about foods and the nutrients to common people and students to improve their health, eating habits. Also, they can share to their families, friends, and near ones. And the opportunities are like, according to the NFXS5, the malnutrition problem like stunting, like wasting, the child obesity, anemia in children worsen in the past of a decade. So it cannot be denied that appropriate programs and strategies are but effective implementation is the key to success. For effective implementation, government should engage NGOs wherever malnutrition status is not improved or wherever the malnutrition is on a higher side. With the support from donors, we implemented the breakfast program in the Tamil Nadu. The program need to scale up because many children from economically weaker section are skipping the breakfast and they are directly having lunch. And need to introduce, like in the current MDM program, we are having base menu, mainly this rice-based, dal-based, sabji-based items. Like need to introduce like fortified items like chicky, bars, cookies, gummies in the program. Yes, ma'am. Thank you.
Thank you so much. Thank you. I'd like Dr. Agatha Betsy to give her initial opening remarks as well, please.
Thank you, ma'am. Aina, could you give me the rights to share? I just need to share a couple of slides to put things into perspective as to why adolescence is such an important stage. Yeah, thank you.
Yes. Yes, ma'am. Now you'll be able to present.
I think yes. Okay. So, just let me know if my slides are visible.
Not just as yet.
Not yet?
No, ma'am, not yet.
Yet. Okay.
Or if you could possibly.
Is it visible now?
No, it's a black screen.
Still a blank screen.
Maybe if you can send it to Aina, she can present it.
Okay.
Yes, ma'am, you can share it to me, and meanwhile you can go on with the topic.
Okay, so I'll talk over, ma'am.
Yeah, now we can see. Now we can see.
Yeah, it's visible. It's visible, ma'am.
But I think
we can see now.
It's visible. Okay, thank you. I don't know how to really. Is it?
Yeah, go ahead.
Age. So adolescent age. Am I audible? Hello?
Yeah, you are.
All right. So adolescence, as defined scientifically, is a stage between 10 to 18 years by ICMR, and WHO defines it as age which 10 to 19 years. It is again divided into a series of early adolescents and late adolescents, given the different types of changes that happen. And we see a whole lot of changes which happen during these stages, which is, and rightfully, it is called the second growth spurt after the age of infancy, where we are developing the organs, and here we are maturing the organs. So we see a whole lot of changes from physiological to sexual to neurological, behavioral, and social. And the biggest thing, just to put things in perspective, why there is a lot of need of adequate nutrition and sleep and other things to maintain a normal growth paradigm here, is because we the child or the person attains the highest height during this point, and there is accrual of bone mass, there is deposition of minerals in the bones, and at this age what we call is peak height velocity, which requires adequate nutrients to be put in, be it protein, be it calcium, vitamin D, to maintain all these changes which happen. Of course, with reference to weight, an adolescent child puts on 50% of the adult weight during this time period. And along with that, we see an increase in blood volume, which needs excess amount of iron here. And along with that, we see that there is change and increase in other organs as well, like heart, brain, lung, liver, kidney. Therefore, because there is a whole lot of changes occurring at such a high speed, such a high velocity, there is adequate nutrition and sound sleep along with that, which is essential to develop this foundational stage and help the adolescent to develop into a healthy adult. So some of the nutrients that I've highlighted, which are ultimately very important to maintain the growth that happens during adolescence. Proteins are there, fats, which are of different quality, varied qualities of fats are required, calcium and vitamin D for bones, muscles, iron, zinc for immunity, and blood maintenance are very important. And give a peek of what the dietary requirements are. So the dietary requirements for proteins, calcium, iron, zinc, folate, and B12, along with A and D, are the ones which need to be taken care of while we are deciding a meal or when we are communicating to an adolescent to maintain their nutritional status. And sometimes the diet that they take is not capable of providing all these nutrients in the adequate amount, and fortification of certain foods, which we will be talking about later on in the discussion as well by other eminent speakers, is very important to meet these recommended dietary allowances by the adolescents here. And of course, coming down to what all are the determining factors which impact adolescent eating behaviors, we see from emotional to physical to social to cultural, adolescents are under a high pressure for all the surrounding drivers and determinants, and therefore it becomes very imperative to give them a knowledge of how to really build in a behavior which is sustainable and yet helpful. So some aspects where speakers also alluded to the intake of foods which are high in fat, sugar, and salt should be controlled and should be managed so that they do not get into the episodes of overconsumption. Portion control, mindful eating will definitely help them to manage such episodes wherein they lose control of their habits under emotions. And we've gone through that there is very less consumption of energy-rich foods and the nutrient-rich foods by the adolescents. And there are deficiencies which are being highlighted at the national level as well. And the episodes of overnutrition are increasing, given abdominal obesity is very predominant among Indians. And then we see anemia is again worsening. And there is a vicious cycle of malnutrition. Once the adolescent is malnutrition, and the entire chain from adult to child to the developing population all get under the influence of malnutrition. So, and of course, it becomes very important because it is an age where the investment of nutrition has got a higher rates of return, as we see. And therefore, investment in adolescent nutrition becomes very important and imperative, not only at global level, but also at national level. And we've been seeing that there are many initiatives, as she ma'am shared, that we are doing many things at global level and at national level also to curb and to check the adolescent nutrition is at right pace. So that's it from my end, and I'm open to take any questions with respect to the same. Thank you.
Sure, we'll come back to that. And thank you so much, Dr. Gatha. I'd like Ms. Megha Manke to maybe give her a few perspectives on this topic.
Thank you, ma'am, and thanks to all the panelists who gave such a wonderful brief. Thank you, Dr. Agatha, for that statistics. I would just like to say, to me, adolescence is a stage, it's a very vulnerable stage, and nutrition intervention during this stage can ensure healthy, future generation. So taking steps to address undernutrition prevalent among adolescent girls can directly impact the babies they are giving birth to. So adolescent become undernourished adult and then give birth to a baby who is thin and stunted and then undernourished. So these babies are also prone to various kind of infections, and therefore today targeting adolescent for a good nutritional intervention is a really very essential, because that's a vicious cycle that we are getting into. So we need to break that cycle and nourish our adolescent to have a healthy nutrition.
Absolutely. Thank you so much, Ms. Megha. Ms. Shilpa Joshi, would you like to please give your initial comments?
Thank you so much, madam. Am I audible? Okay. So there is really very little for me to say because most of it has been said and it has been spoken so beautifully. But because I'm a clinical dietitian and I see clinical problems among adolescents every day in my clinic, I think what food does is actually impact a lot of metabolic problem. Choice of food actually is impacting a lot of metabolic issues among our adolescents, especially girls. We were speaking about anemia, but if you look at the urban cross section among adolescent girls, PCOS is become a rampant problem among these young girls, and it is directly, I'm not saying there is no metabolic back end to it, but it is all about the kind of foods that they choose, because like you rightly said, there is snackification of food. There is no longer food or meals which are eaten, and a pandemic has just added fuel to fire by sort of restricting the activity among these young girls. So that has become problem. Other problem is that this is the age when adolescents want to do something with themselves. They want to build their life. So, there is a lot of emphasis on education, and they are sitting in their online classes from morning through evening, not doing much of physical activity. So I think early progression of metabolic problems among adolescents like PCOS, type 2 diabetes. When I began my practice 25 years ago, I would get type 2 diabetes at 40. Now I'm seeing it at 15 and 20. So that's a huge issue because we are creating a whole generation with metabolic burden right in beginning of their life. I think that is something to consider. Hypertension is a huge issue, and we know that life doesn't get easy later on, and therefore stress is going to increase. And if they are already with hypertension, it's just going to worsen the whole issue. So I think, yes, it is very important to understand problems which are related to malnutrition, but malnutrition of protein, malnutrition of fiber, excess of calories, excess of salt, sugar, fat, lack of essential fatty acids among adolescent. I think these are problems. And like everybody said, food is a choice which we make 3 times a day, and so do our adolescents. We teach them how to vote. We teach them how to pick up between science, arts, and commerce. We have so many tests for them to understand what career path to take, but we never educate them about in a buffet which food to pick up, which is not going to harm them later on in their life. I think that education is so, because teaching them protein, fats, and carbs does not help. What helps is in an array of food which is put in front of you in the market, what is it that you will pick up which is going to benefit you? It is just not the, that protein has nitrogen and fat has 1 double bond and 2 double. I don't think that education really translates into practicality. These are my thoughts on it. Thank you so much.
Thank you so much, Ms. Shilpi. Maybe I'll start with a few questions then. The first one being for Dr. Wagulkar. What has been your experience through the public health initiatives that you've been doing, especially on maternal and child health nutrition? And also you've been working on SAM, which is on severe acute malnutrition. So what has been your experience through the school feeding programs? How has it worked? It would be great to hear what are you seeing as some of the challenges, opportunities, in this space.
Thanks, Ms. Rinka. I think to just put it out there, if you talk about the public sector programs and how they're doing, so I think overall our governments as such, be it the state governments or be it the respective governments, I think we have good, robust programs in place. I mean, we have sufficient, I would say, interventions in place. We talk about, Arunji mentioned about a weekly iron folic acid supplementation program. We talked about food fortification as one of the intervention. We've talked about nutrition and health education. I think as such, our programs are robust enough. We have the interventions in place. But again, as the different panelists also did talk about it, it's basically realizing and recognizing adolescent nutrition as one of the important piece of that entire jigsaw puzzle of, say, good nutrition across the life cycle. Realizing the importance of that Secondly, also giving due attention and due priority to addressing some of the adolescent nutrition issues. It's just like as simple as my co-panelist Shilpa ji mentioned here, that you have a buffet out there, but what item to pick up and what not to pick up, or which is good for you, which is not. I think that is something which I feel is in a sense, it's an area, or it's an area of opportunity. Also, it's a challenge area as well. If we talk about the awareness and the behavior change, exactly what is needed, I think that is where I see it both ways. I mean, you could say it's a challenge, but definitely it's an area of where you could improve on and work on. And that is where at the World Food Program, in fact, there have been a lot of initiatives that we have taken in this regard, be it involving children in things like involving them in a game kind of a thing, where you involve them in games where they play with different, like it could be a snake and ladder game where they're playing with, say, 10 different kids out there, but just a slight bit of twist to the snake and ladder, saying that when you land on the head of the snake, it means that you've not consumed the right product, or this product you've consumed, and that is where you've gone down the snake's tail. And likewise, if you get a ladder, say if this is the product that you've consumed, say it may be something like a green leafy vegetable and you've consumed that. So I think these are some of the initiatives that we have taken across and we are working on. And I think that has been my experience as well, and that is where we come from, is that your interventions are there and you have development partners, you have so many agencies wanting to improve the nutrition of adolescents across children and as well. And the key gap here that I see is behavior change and communication. If we are able to also work on that simultaneously along with the interventions that we are doing, along with the efforts that we are putting into, I think that is definitely will go a long way in also improving a lot of issues around nutrition that we talk about, especially from the public sectors here, or public health avenues.
Right. I mean, I absolutely could not agree more that nutrition communication is, I think, extremely important. Apart from it, being idealistic, and we'll come to that, and I want to spend some time on that a little bit later as well, in terms of how do we improve, therefore, this whole thing of adoption of some of the changes that we want, because it's always nice to say, I want fortified foods and I'm going to be supplying this into my supply chain. But how much am I adopting? How much am I repeating that same behavior? I think is a whole job to do. And we'll come back to that, because I think that's an important topic to discuss. Mr. Tanmay, I think I'd like to ask you, what is the kind of positive impact you have seen in, especially when it comes to adolescent nutrition, through some of the initiatives and programs, through the World Food Program and other initiatives you've been involved with? It'll be good to understand if you've seen certain successes that have happened in certain parts, and what is the kind of success you've seen and positive outcomes you've seen.
Thanks, Ms. Rinka. So in terms of these adolescent thing, means the age group of 10 to 19, which I have seen that the coverage of midday meal scheme, that is now the PM Poshan scheme, that is Prime Minister Poshan Shakti Nirman, the name has been changed now. So if you see that the coverage of adolescent children, that is the from 10 to 14 years of age, means the actual age is 19, but under midday meal you can serve up to class 1 to 8. So the coverage is nearly means 5 crore children, means more than 5 crore children, those who are going to government and government aided schools. So it is a kind of thing, and many studies has proven that there is a improvement of the nutrition of this group of children. Along with that, it has supported increasing the enrollment in the school as well. That is the kind of hunger they are facing, the children from the underprivileged community. They are now coming to school and they can now concentrate on their study. And it is a very important for building the human capital. That is the human capital for building our nation. So it has been very, the midday meal scheme has proven to be very important for supporting the country's economy in the long run. Apart from that, in terms of midday meal scheme and some of the initiatives that government has taken, I can mention that recently they have taken the fortification thing. Apart from the fortification thing, considering the food safety and hygiene, they have issued various guidelines, and based on that guidelines only, World Food Program has developed that mobile app for the training of cook-cum helper who are situated in various geographical locations. And one more important thing to address the issue of malnutrition and to address the issue to add more nutritious value into the meal, government has also introduced the Nutri Garden thing, and they have published the guidelines for that purpose also during the year 2019. But due to the pandemic thing, it has not been started in that much pace. But World Food Program has started working on that area as well, and we are bringing the global best practices on this field of this setting up of Nutri Garden, and we are hopeful that we will definitely produce some good result, like we have produced a good result in terms of the rice fortification. So these 2-3 things, I think they have proven to be very important and useful to address the issue of adolescent nutrition in our country.
Can you just maybe elaborate a little bit more about the Nutri Guardian you said, and to our audience, just so that they understand what that is about?
Yes. So the Nutri Garden thing is, as you all know, if you visit the some of the schools of the rural areas, that you will see that the school has themselves developed some kind of school Nutri Garden in their open and vacant places. It was in practice. I mean, in our balcony also, those who are living in the urban areas, we develop kind of kitchen garden in our balconies also. But in it was not in that formal shape, but government is now trying to develop it on a give it a formal shape for the developing the Nutri Garden, school nutrition garden. And for this purpose, government has given some guidelines how to collaborate with the Krishi Vigyan Kendra to understand more about the what kind of vegetables can be grown considering the agroclimatic zone, and how we can collaborate with the other government scheme for getting the necessary funding and the other support, like MG Narega, like National Rural Livelihood Mission. So it is a very interesting thing. And as World Food Program, we have also started collaborating with some renowned national level institution to start the pilot project, and we have already started this initiative. And for supporting this Nutri Garden, government has also started giving kind of funding support to the state through the midday meal scheme. There is a concept of flexi fund in the midday meal scheme, and government is encouraging states to utilize that fund to setting up of the nutrition garden in their schools. So due to this pandemic thing, I think there is no such reliable data now, but going forward we will must have some reliable data that what kind of nutrition garden the states are setting up in the schools. But I'm sure that if anybody visit the rural areas, in many of the schools there are already nutrition garden in the schools.
Right. Thank you so much. Yeah, thank you so much. So Dr. Gulati, I think it'll be interesting to hear from you, like what are some of the critical sort of nutrition and health challenges and more physiological challenges that you see which the adolescents are facing today, and what would be some of the suggestions that you would like to offer today to adolescents, also fitting into their lifestyle, right? I mean, it's nice to tell them, okay, eat this and don't eat that, but it's very difficult for them to adopt. So how would you, what is the kind of advice would you want to give, to the adolescents?
Okay. To begin with, I think the 3 major challenges that others have also enumerated, and I'm reiterating them. The 3 major challenges that we face in adolescent nutrition is undernutrition and stunting. Number 2 is the micronutrient malnutrition, specifically anemia, vitamin D deficiency, and third is obesity. So these are the major challenges that we face in adolescents, whether it is girls or boys. So these need to be addressed, and what we need to tell them is to make food aspirational, because what happens, why are even in the rural areas people moving towards what we call as not so good foods or not so healthy foods. We are like in the urban areas, we have burgers and the fries and things like that. In the rural areas, they have bun tikki, they call it differently, but they eat that because it is aspirational. Because they say if those who are in the urban areas, those who are going to fancy schools, if they eat all this, why should we not have? So we have to make eating healthy foods very aspirational and, as they say, a very cool thing to do, whether it is in the urban areas or it is in the rural areas. Obesity is something that no one wants to have, but they have it. So we need to just teach them that why they are getting obese. One, yes, they must exercise, but it is also very important to eat right. And when we talk of eating right, yes, fruits and vegetables need to be added. But you see, fruits and vegetables are not always affordable in the way or in the quantities that normally the adult population may require to have. So from that aspect, perhaps we can introduce this concept of looking for plus F logo, which signifies that this food is fortified with additional micronutrients. And when these young kids, these adolescents, when they go and tell their parents, or when they go shopping with their parents anytime or on their own, if they start asking for staples which have plus F, then perhaps even the industry would come on board because there's a demand for those fortified food products. Now, as you rightly said, it is very difficult to convince the adolescents what to eat and what not to eat. And if we just tell them that these are junk foods, or these are very high in sugar, these are very high in fat, they're high in salt, and hence not good, they're not going to listen to us. So we have to actually work with them how they can have, more and more healthy eating days and a few cheat days where they can eat what they want, be happy, but that is only in a very limited manner. Another thing that we really must tell them is that they should come up with different activities at the school level, either not necessarily calling them the healthy recipes, good for health, because no one is interested in that. But if we rename them as creative recipes, using fruits, using vegetables, using a combination, like when we were dealing with school children, whether in my children's school or otherwise, we said that in how many colors can you make chapatis or the paranthas? Believe me, not many knew. So what we said is, why can you make red chapatis? Can you make green chapatis? Can you make yellow chapatis? And we just nudged them to think. And in Madhya Pradesh, when we tried this out in schools, they came up using, beetroot to blend it with flour and make red chapatis. They had those green leafy vegetables, pureed and, kneading the wheat flour in the pureed green leafy vegetables to make green chapatis. So that added to the fun and that added to nutrition also. So maybe we can make nutrition creative, interesting, and not just boring, having more of green leafy vegetables, eat more, eat less of potatoes, eat less of fats, because that really doesn't work. So my suggestion would be to be creative, make it as a goal to have a smart choice. Smart choice has to be healthy and nutritious, but we have to sell it as a smart choice to the adolescents. And that's where I would stop, because I think a lot of others have already stated very good points.
No, and I think it's again, like, I mean, this is another point that I would absolutely agree with, is that how do you make making a choice of eating healthier food and choosing healthier food desirable, not
Yes.
something that they absolutely, unfortunately have to do. It needs to be something that I look forward to. It's something that I want to do rather than something that you need to do, right? And therefore I think also one of the things that we saw, and I read that yesterday, is the FSSAI coming up with the health star rating, and I think that's a good initiative. And because what it does is helps the consumer, and in this case the adolescent, empower them to make a choice whether I want to have a 4-star rated product or a 3-star rated product. You are empowering them to make a choice of what is healthy food. Yeah. And I think that's a very good initiative. Sorry, you wanted to just add on something?
Yeah, I just wanted to say, it is just we've tried it out in school in Madhya Pradesh, in Rajasthan. When you give them, vegetables and chapatis, they don't really like, but you convert them into veg rolls, they love it. So it is just same thing done differently, and the same vegetables stuffed into chapatis and made into a roll, and they love it because it is the cool thing to do. So those are the kind of things that we really need to excite the adolescents to have something interesting, which is healthy also, but it is also aspirational for them, because that's what they look for. Over to my side.
No, and I think behavior change is going to require all of these initiatives. And I think and I'm just thinking loudly, but I think one of the examples I would, or parallels I would draw, is with how children have become a lot more environmentally conscious today. They are doing a lot about waste disposal. They are doing a lot of things, and that's been made a cool thing to do. It's a good thing to do. And I think that's the same route that possibly nutrition will need to take. I mean, we need to move in that direction to see how are we going to get sort of adolescents and kids in general to sort of make this a good thing to do. Similarly, I would say even a Nutri Garden can be something which is sort of a gamification, like Dr. Siddharth, you were talking about, where even they as stakeholders are involved in growing better crops, in growing healthier food, things like that. So I think it's everybody's involved would be a very, very interesting evolution, I would say. Mr. Devaraju, a question for you is, having worked, I mean, and you did mention about some of the challenges on the costs for managing some of these school feeding programs. What would you say are some of the other challenges, but also equally the opportunities, which possibly the vehicle that something like an Akshay Patra has given to be able to reach out to so many, millions and millions of kids, are we utilizing that opportunity sufficiently, or you think there are actually a lot more opportunities that you could use using these vehicles to get better nutrition into the right population?
Yes, ma'am. Like currently we are having customized vehicles. They are carrying the SS vessels containing food, and we are maintaining right temperature. Like the temperature of food should be 60 degree and above. And we are serving like cook to consumption time is within 4 hours. So the vehicles, and we are delivering the food on time using those vehicles. Yes, ma'am. Like that, we are using those vehicles for delivering Anganwadi meals and midday meals, and for supplying the COVID meals as well. Yes.
And I would say it would be interesting for you all to also look at, and I don't know if there is an opportunity through technology, etc., to look at how do you get even chilled products. So, for example, are we able to get dahi to our kids? Are we able to get, more chilled products to the kids rather than only hot products? And that could be an interesting thing to also explore. But do you see other opportunities which could be, like you mentioned about gummies and chicky and some of those formats as well, which could be very, very interesting to, get a dosed amount of nutrition into the children at different times of the day. And you rightly said, I mean, kids come into the school hungry, and they're eating straight away at maybe 11:30, 12 in the afternoon, right? So do you see any other food formats or anything else that, you feel that would be an opportunity for programs like yours?
Right, ma'am. Currently, we are providing midday meal as per the government norms. Like for primary child, the nutrition requirement for primary child is about 12 gram protein and 450 calories. And for upper primary child is about 20 gram protein and 700 calories. Like government is given the menu, like that is a base menu. apart from base menu, we are giving the items like products like curd we are providing in some parts of India, and we are providing like many items like sabjis, curry items, and the like in like suppose if we take Gujarat, there we are providing churma and this boiled chana and these snack items like this one, groundnuts, like that. In different parts of India, we are providing variety of additional item other than the government menu. And so, if we take the Uttar Pradesh, we are providing additionally fruit items like seasonal fruits. We are providing. If we take the Andhra Pradesh, we are providing additionally these boiled chana, chickpeas. In Karnataka, we are providing cornflakes, like other additional items we are providing, so the menu and the children will get the variety. Like that, we are providing additional items, and yes, ma'am. Hope it answered
Sure,
the
sure.
question.
Oh, thank you so much. Yeah, Dr. Agatha, I think, what have been some of the major changes in the RDAs, related to adolescents, and why have these changes been made in India right now? So maybe if you could throw some light on that.
So RDAs have continuously been developed for Indians since a long time, since 1994 we started. But the main difference that we see now is that we are relying more and more of our own data. Earlier, we used to take data from global references like WHO, FAO, and we used to derive RDAs, and the facilities and technology studies were very less with respect to Indians. So we have been gradually evolving at that front as well. And the recent change in RDA is actually it's evolved as a concept from RDA to a different set of requirements called ER, that is estimated requirements and tolerable limits. We cannot provide RDAs, which are a set of requirements for 97.5% of a same age group. However, they have also extended it to 50 percentile population, and also a set of requirements which would be which would cause harm if intakes are excess. And this is keeping into perspective that there's changes in the methodology. There are changes which are incorporated in the studies that we've been seeing. We are now more referring to the bioavailability concept, how much of a nutrient is being available to the body as well. So these aspects are put into perspective, and then all the RDAs are being revised. And we see some of the RDAs have increased now, and some of the RDAs have decreased also. For example, iron and protein also. And for protein, we are now concentrating more on the type of protein, the quality of protein, rather than the quantity. And we've talked earlier also that in some of the adolescents, the trend and the cult is just to have protein on and without assuming what this protein does to their body. So while protein is a very important nutrient for their growth, for the growth spurt that they have, bone development, muscle development, but over intake of protein is also not recommended. So there is an adequate calculation done as to how much of the protein will get deposited, and over and above is also not allowed. Therefore, protein intake has been decreased. Same is the case with iron, where the recommended dietary allowances have been reduced, considering the bioavailability. Earlier, it was considered that the lesser amount of iron is being absorbed by the body. And now we see that the bioavailability has increased from 5 to 8%. And therefore, lesser amount of iron can do the job. And the requirement has been decreased. And similar is the case for some other nutrients. But over and above, we see more of the nutrients have been increased in their requirement, given that they are lost during processing, given that their bioavailability has changed, given that we have new studies for Indian population now. and which has been giving us an insight on the changes, on the deficiencies also. Vitamin D, which was earlier at 10 micrograms, has been increased to now 15 micrograms, given the level of deficiencies that we are seeing. Same is the case for vitamin B12 as well. So a whole lot of considerations, and mostly with respect to Indian setup has been done for 2020 as the new set of RTAs.
Thank you so much. I think that was very informative. I would like Ms. Megha Manke, and you worked a lot in the area of, obviously fortification, and we will come to the point of, do we also sometimes have a risk of over fortifying? And, because everybody like Dr. Gatha said, there is a lot of products out there saying it's high in protein, high in this and high in that. Are we then also having a risk of over fortification and too much of it going in? And maybe you could throw some light on that. But what is interesting also from the work that you've done is you worked a lot with pediatric patients with cancer. You've worked in that specific area, certain disease conditions. So even in adolescents, and there is today a lot of child related or adolescent related conditions also that exist, whether it's diabetes, cancer, and so on. Are you seeing specific requirements that we need to be looking at for addressing the nutritional needs of these kind of disease conditions in adolescents?
Thank you, ma'am. Thank you for asking that question. Of course, ma'am, we do see need to address it, the specific condition for these children, because there's a huge difference when we talk about a normal adolescent child and a child with cancer. So nutritional requirement, the need, the challenges, the symptoms that they are going through all differ. They change a lot. So however, when we talk about the children with cancer, the requirement change drastically, and these changes depend on the type of the cancer, whether it is a solid tumor or hematological malignancy, stage of the cancer, and majorly the symptoms the child is going through. So treatment, as we all know, the treatment of the cancer will involve 3 of the treatments. So either it will involve chemotherapy, radiation therapy, or surgery. And each treatment, rather each cycle of this protocol will portray a different type of symptoms. And it will be individualized. So one child will have some other symptom with the same chemotherapy, and the other child might have different symptoms. So depending on the body type, the weight of the child, and the anthropometric status of the child. The dietary intervention also change a lot. So from oral diet we have to supplement the child because of the weight loss, the cachexia that they have, to nasogastric feeding, and also to parenteral feeding, that is the intravenous feeding. So in my experience, I've always worked with a lower socioeconomic class parents and children. So apart from the challenges that we face, giving them a kind of a protein supplement or a high calorie supplement for them to gain weight, or the anorexia they have, to give a proper nutrition to them. It is always a challenge to give a particular supplement because of the cost issue. So however, here I see a great need of public-private partnership, and we were having that because the government hospital where these children are admitted tie up with, or collaborate with various industry people under their CSR project. Various developmental partners come in front, and then they are the people who donate such supplements to them, because believe me, the cost of these treatment, the cost of cancer treatment is tremendous, and to bring the child out of this deadly disease is very important. Apart from this, nutritional education played a very important role. So parents coming from this background, they had a set rules in their mind about nutrition. So different perception towards nutrition. Moreover, getting them out of that negative zone that my child will not survive, to your child needs right medical treatment and right nutrition to get out of deadly diseases, something which was really challenging at that time to make them understand. However, we had various IEC materials to teach them. So we had flip charts. Then we also conducted parent support group meeting, pamphlets. Then we had short snippet video which used to run through the TV, where the children and parents used to sit in the OPD. So all this really helped. And also, different games, as Dr. Siddharth rightly said, we had that snake and ladder game, a big snake and ladder, where we used to teach them, difference between the healthy and the junk food. So also, apart from what we serve, the midday meal, MDM meals to the school-going children, we also had a hot meals for these children, because as in the public, government hospital where there is lot of patients, 50, 60 patients in one OPD, a lot of time, is consumed of those parents and children. So we made sure by giving that hot meals, at least 30 to 50% of their requirements are met up. So this was the major, the challenges. But what we need now is there are lot of schemes and a lot of programs we have currently. FSSAI also, have a fortification program that we are, through RISE, we are making a mandate now. So we have everything, but it is very important to disperse this information in the right way to various more and more adolescent population. And public-private partnership, the collaboration between this, organizations are very important. WFP and of course various developmental sectors are really doing a great job. For optimum impact, I need this collaboration is very important. And as Dr. Agastha said that, we need more data. We already have Indian data, but I think if we have that kind of public-private collaborations, we will come up with more research, more Indian data to actually authenticate what we all are saying today. So that is, I think, very important.
No, absolutely. And I think, especially when you have disease conditions like cancer, etc., where the cost of treatment itself is so high, for you to be able to also make nutrition affordable is important. And it's not just about, giving in very high, I mean, of course, and I'm sure calories are also important, like you need to have a certain calorie diet, etc. Your calorie requirements go up and things like that. So I think that's another topic maybe, and, that's that, but that's the whole thing about saying, how do you make nutrition affordable? I think Dr. Dipti, you wanted to say something.
One, I'm not doctor, so
Oh, sorry.
Dipti. And secondly, I just wanted to share that, a lot of times it has been mentioned that, and Agatha just mentioned about, fortification and the fear that perhaps it can lead to, higher levels. I can assure you one thing, fortification can never, ever exceed even the RDA, leave alone the tolerable upper limit. So let's be very, very clear that under no circumstances can fortification ever lead to any harmful impact. What we really need is to scale up. And here I just want to say, since we're talking about adolescents, you are all aware that Government of India conducted this CNNS survey. And in the CNNS survey, that Comprehensive National Nutrition Survey, when they were doing the levels of micronutrients amongst level of micronutrient deficiency amongst adolescents, a very beautiful thing has come up, and it is all in public domain. It's not me talking about it. I was with GAIN, and we had introduced fortified oil and fortified milk in entire Rajasthan. So the entire Rajasthan was getting fortified milk and fortified oil since 2012 onwards. It scaled up, but by 2014-15, it had almost saturated that all the packed oil, all the packed milk was saturated, was fortified with vitamin A and D at the levels recommended by FSSAI, and they were all validated by the quality assurance that GAIN had put in. And the beautiful part is that when you look at the CNNS data at the all India level, the vitamin A deficiency in children 5 years to 19 years is between 15.5 to 21.9%. Whereas in Rajasthan, it has come down to just 1.5 to 1.1 to 1.5%. And this is not me saying, this is Government of India's data. And when the CNNS data came in and the fact sheets came in, and my instant reaction was to first look at how it has fared in Rajasthan. When I saw that it was the vitamin A deficiency was just 1% and 1 to 1.5% in the age group of 5 years to 9 years, believe it or not, I couldn't believe. I had to actually use a magnifying glass to see if I was not missing out on the position of the decimal. But thankfully I wasn't. And when all other parameters lack in Rajasthan, why vitamin A deficiency was so less? Perhaps it was because of fortification of milk and oil with vitamin A and D, which all children were consuming. So fortification is an excellent complementary strategy that Government of India has adopted to bring down the raging levels of micronutrient malnutrition, because they impact us very differently. So I just wanted to clear this, and with the evidence. Similarly, just one small point. In 2012, we also introduced fortified wheat flour through the PDS system in Rajasthan. And it was distributed through the PDS system for 2 years. And when we had the NFHS 4 data, which showed that iron folic acid tablet consumption was 10% compared to 30% at the all India level. When we looked at the dietary diversity, it was just about 10%, 9.8% in Rajasthan compared to, about 60% at the all India level. The hemoglobin levels or the anemia levels in Rajasthan, in adolescents, in pregnant women, in women, as well as in men, were 7% lower than the national average. The national average showed that anemia amongst men was 22.7%, and in Rajasthan it was 17%. In anemia amongst women, about in the age group of 15 to 49 was about 53% at the national level, and it was 46% in Rajasthan amongst the same age group. And that perhaps could be because most of the population covered through PDS, that was about 68%, were getting fortified wheat flour, fortified with iron, folic acid, and B12. So fortification does help, and it should be adopted without much, without any lack of confidence, and with as a complementary strategy to good food, nutritious food through the natural sources. Thank you.
Right. Thank you so much. Yeah, I mean, I would also like Ms. Shilpi to, give her your perspective on the other big disease condition that we have in India, and the big pandemic, I would say, in some ways go bigger than COVID possibly, is the whole diabetes pandemic, right? So it is it's a situation, and I always say that it's almost like a ticking bomb, because we do have a very, very large population, and we do see a lot around child diabetes today, and not just adult diabetes. And so I'm sure as the adolescents, especially with the amount of processed foods, which is high sugar, high fat, all of that being consumed. So what's your sort of view on this, and how can that be managed with adolescents who are prone to things like higher sugars, etc., in their diets? In terms of really looking at the overall nutrition for kids with these kind of challenges.
So, very interestingly, there are two facets. There is malnutrition and fortification at one end, and there is, imbalanced nutrition at the other end, which is leading to all these metabolic issues. And like you rightly said, with COVID, probably COVIDosity, that is obesity coming out of the COVID pandemic, and hence leading on to diabetes, has become a huge problem. Not that it wasn't a problem before the pandemic hit, it was there. The bigger problem, ma'am, which I feel is yes, we talk about nutrition education among children, but I think it's more important that there is nutrition education among mothers, because more and more that I talk in relation to urban population, because that's where I work. And what I see is there is a huge social burden among women to be called as good mothers, to behave in a certain way and choose certain foods. So if that is, as it is impacted on the way children eat and children choose their foods. So while, I don't know if I should say all this, but in my practice, when young children, adolescent comes with type 2 diabetes, And a lot of time, a mid-time snack is asked. And I say, you know what, you can give a fruit and nut to your child as a snack. And the mother says, yeah, wo to denge, par khane ko kya de? You know, matlab, what is the snack that I can give? And I think this whole perceptional change is required, where, you know, we talk about nutritional diversity and we talk about including 5 exchanges of fruits and vegetable. That's all theoretical. A good mother is a mother who makes aloo ka paratha and gajar ka halwa in India, and otherwise she's not a good mother. So I think there is a huge social change which is required. Only then we'll be able to tackle all these problems, because in schools we see, although, you know, a lot of schools have made it mandatory that the snack has not to be processed food. It has to be homemade food. But these homemade foods, what is made at home is not always not processed. It can be extremely highly processed and still be made at home. So I think the nutritional awareness has to come in, and it has to come in through the route of parent, because even at adolescent, there is very little financial independence. Though Swiggy and Zomato have become part of everybody's phone, the bill is still paid by the parents. And if they refuse to pay the bill, I think a lot can be improved as far as the selection of food which goes, especially in children, and that will go a long way in preventing obesity. And you know, the outcome of obesity is all the metabolic diseases which hit the adolescents. So I think it's very, very important first to recognize what is processed food. It is not necessarily what the food sold in market. At your home, you can process food to convert it into highly, highly refined food. And I think that is something which is very important.
And I think, you know, the other challenge, of course, with so many women today in the, you know, working population, right? So, you know, everybody is working, maybe working from home or working from office, but there is a very high workforce out there. And therefore, sorry, you were saying something?
Just to add on to what you were saying, you know, we are, all women here are working women, right? Yes. I mean, you are, and everybody else here is a working woman. I think the perspective about food needs a overall.
Yeah.
Food does not have to come out of a kadai. It can also grow on trees, you know, and what you pluck from tree is also food, and it just doesn't have to be a deep fried thing or something, you know, something like this. So I think that is, the perspective has to change, especially when there are a lot of working mothers or women are working. So, you know, they, if their children can choose these, or they can help their children to choose these foods, I think a lot can be achieved in terms of eating right.
Absolutely. And I think that brings me to the point, actually, from a food industry perspective, and a lot of the food formulators, and I'm a food formulator, I think the option to produce convenient food, because the mother needs to be able to do it within a certain time. And we know from the industry perspective, I know that breakfast is the biggest occasion where the mothers are in the maximum amount of stress, because they have little time. They need to make sure that the food is getting made and all of that. How do you ensure that you're giving healthier choices of food products during that time? So it doesn't mean that if the food is processed, it's bad. It means that you can use that processed food as well to make it a healthier choice, maybe a healthier, you know, food. Just the other day, I was buying some batter for my kids to make dosas. I didn't even see the pack, and I just picked up the pack and I made it, and it was a ragi batter, actually. But what quickly comes to you, and as a mother, is like, okay, let me put some onions, let me just make it tasty. And the kids couldn't make out that it was ragi batter or whatever. They just ate it, and they were very happy eating it. So I think it's a question of also, and you're rightly saying, you know, how do you educate mothers to make it very interesting, very desirable, make a very interesting recipe out of it. So make it exciting, you know, for mothers as well, to be able to convert something which is bought out of a pack but made healthy, you know, whether the packet itself is healthier or you have made it healthier by adding stuff to it. So I think those are all things that, you know, we could play with, you know, and I think that's something that's interesting for food formulators. So what I'll do is I'll just open up this conversation to all of you. What do you see as the role of fortification specifically onto food products? And do you see, whether it's urban or rural, you know, sort of consumers, that there is a big role for fortification to be played to enhance nutrition? And I'd leave it open to any one of you to answer that.
Ms. Banerjee, if it's okay if I can come in?
Sure, please.
Sure. And I can see, I think, I'll come in with some of our perspective. I think the way we see fortification is one of the complementary strategies to addressing anemia and micronutrient deficiencies. It's definitely a part of the larger gamut or the larger programs or the interventions around reducing micronutrient deficiencies and anemia. Having said that, yes, it is a cost-effective solution. And we talk about rice, we talk about wheat flour. I think it definitely is a cost-effective solution and well-proven intervention. In fact, we are talking about, as we all know, we talk about iodized salt and, the impact that it's had on the public health. So I think that is where, again, fortified foods as such, it's a good intervention. The only thing is that we also need to side-by-side work on the communication around it, so that people who consume it are also, it may be a rural, urban, not necessarily, it's not restricted to a particular geography, but we also need to work along with the communication on it. And just while I talk about communication, and I just would like to give a sort of a homework or a takeaway message for all of us. Whoever is attending the meeting, not just the panelists, but even the participants. How many of us are aware about the +F logo that Deeptiji talked about? We are all aware about, there's a red logo, which means that the product is a non-vegetarian origin, or a green logo, which means that the product is from a vegetarian origin. But the +F logo, and courtesy to some of the stalwarts who are also there in this meeting today, but you would see that in most of the oil brands that we have these days, you would find a +F logo. In most of the packaged milk products that we have, you would find a +F logo. And it's just a simple exercise of just going to our own kitchens, looking for that pack of oil or looking for that pack of milk, and finding that +F logo. I think the more you see it, soon you'll realize that you are also looking at fortified foods which are also there in our day-to-day lives, and it are also impacting us. But again, it's about health education, or it's about the communication or the education about fortified foods. So I think that could be one of the take-home messages. With that, I would like to end it here. But of course, we'll leave it to the other participants.
Sure. No, thank you so much for giving your take-home message, because I think that was my last thing that I wanted to do with each one of you, is just from my side, and then maybe we'll leave the floor open to a couple of questions, is what is that one message you'd like to give to all the listeners today as to what is it that we should do in adolescent nutrition? What is that one thing that you'd like to leave the audience today with as your take-home message?
I'm sorry, can I intrude in, Rinka?
Yeah, sure, Mr.
Your panel. But as you were talking about fortification, which was very, very, very close to me,
sure. Yeah.
Let me put in my thoughts. One, you were talking about fortification. Two, you were talking about processed food, and I really appreciate what Shilpa rightly said with regard to processed food. In fact, right through, we all were talking about processed food which is packed. And good dimension, which Shilpa rightly told us, is the processed food with regard to home that we are talking about. And that is where the enrichment really comes in. And that's why we talk about fortification. That is enriching processed food at home as well as the packaged food. And believe me, according to me, I'm a strong believer. Food fortification is one of the strongest strategy and the right strategy which India can adopt with regard to eliminating or removing malnutrition and hidden hunger. We have hidden hunger. We don't recognize it because it is hidden, but that hunger is very much there, which vitamins and minerals and micronutrient premixes can help in enriching our processed food, be it home or be it the packed processed food. Thank you. That's my thought.
No, thank you so much, Mr. Arun.
So I want to add a few points, ma'am. From at Akshaya Patra, we are serving about 18 lakh children every day, and all our kitchens are using double fortified salt and fortified oil, and we are getting fortified rice from the government, and also we are using fortified wheat flour in our north kitchens for the roti preparation, and we have started using this fortified rice kernels in our recipe in 2016 in Karnataka, and we are extended to Lucknow later. But currently, we are getting the rice from the fortified rice from the government, and whatever the major products, the ingredients using in our recipe, they're almost all fortified items.
Right. No, absolutely. I think so. I think fortification, like you said, is a very effective strategy. Nutrition communication would be a very important strategy. Any other thoughts as one single message? Ms. Dipti, why don't you give you all one last thought? Is she there? Or?
Ma'am, you are on mute. Ma'am, you are on
Can
mute.
I just add in here just one last line of my end? Okay, so yes, of course, fortification is the way to go. And given that we have 50%, maybe more than 50% of the population, not only adolescent, but more than 50% of the population still consuming less than 50% of the recommended allowances for some of the micronutrients. And now the RDAs have been upped for these micronutrients in order to bridge this big gap which has been created now. Fortification is the way to go. And along with that, we've talked in bits and pieces, all our eminent speakers have talked, the sustainable behavioral change that we need to inculcate is something very important. It has to be a long-term change. It has to be a mindset change, be it consuming fortified food, be it consuming packaged foods, be it consuming foods which are indulgent. Anything which is consumed mindfully would go a long way, is what I would say. And inculcating the habit and educating the adolescent who are the future adults, and therefore building in and nurturing these habits right in the beginning will probably take them a long way to go.
Sure,
so
absolutely.
Sustainable habits and sustainable mindset.
Absolutely. One last comment for each one of you. Just one last comment. Yeah. Is that Ms.
Thank you,
Dipti
ma'am.
you wanted to say? Yeah.
Let Megha say. I'll come after her.
Okay.
So as everyone said, that fortification is cost effective. It is cost effective, but it is also a population wide approach, because everyone at their home, eats a roti, chapati, rice. So it's a best vehicle through which we can, deliver these micronutrients, and there is no behavioral change required as such to give the staple foods to your child. So that's a very, very important aspect of fortification.
Sure. Thank you so much. Mr. Tanmaya.
Yeah, so again, I will bring everyone to the gamut of the school feeding. So we should not forget that the 100 million children starting from class 1 to 8 are being covered through this midday scheme on every school working days. So means that is a very important thing, and government is investing a lot of money, and through National Food Security Act, it has become a right-based approach. So like government has already introduced the fortification of rice or the wheat flour, like but we need some other innovative approaches, like the WP has initiated the capacity building, the cook come helpers. If we can think about the introduce some innovative things to enhance the quality of the midday meal scheme, it will definitely benefit the health and the nutrition status of the children of our country. Over.
Thank you so much. Yeah, absolutely. Yeah, Ms. Dipti and Ms. Shilpi. I think Shilpa. Sorry, you are the two people so left. Ms. Dipti, you want to go?
Yeah, I just want to say that basically no food is bad. So even when to the foods that we say junk foods, they're not really bad. Only thing is moderation needs to be applied. So moderation is the key. No food is good or bad. So, and the other key thing, which is closest to my heart, is eat right, eat fortified if you want to be healthy. That's it.
Great.
Eat right,
Thank you so
eat
much.
fortified.
Miss Shilpa, any last comment?
So just something, I mean, we all agree that fortification is important, but I also think that educating adolescents about making an informed choice of what they are eating, teaching them to weigh in the pros and cons is very important. So nutrition education, which is practical, it has to be scientific, but at the end of it, it has to convert into them helping themselves to make a right food choice is very important. And along with adolescents, I think it's very important that we educate the parents as well. So these are very big choices that we make every day. By choosing right food, we choose right health. And I think that is something that if we do a right food choice, we are actually making a right health choice. And I think that is something that that needs to be, if I can use the word drilled into their head, right, since they are young, and probably since a woman has a child, since then I think it starts needing to be part of their DNA. Thank you.
Absolutely. And I think,
one small thing I want to say.
Sure.
That while we are educating the community, we must bust the myths regarding fortification. And that's what Inoshi ma'am also said in the beginning, because a lot of people may have some quirks in their minds about fortification. And as public health people, we must allay those fears and we must put things in perspective, whether it is food, whether it is fortified foods, whether it is health or anything else. That's it. Thank you.
Absolutely.
I want to add one point. Good nutritional habits and a balanced diet aren't developed in one day, nor they are destroyed in one unbalanced meal. Nutrition education is an important element in the overall strategy aimed at improving the food security and preventing all forms of malnutrition.
Absolutely.
Absolutely. Yeah. And I think, when we talk about behavior change, and I think that's why I always insist that behavior change can happen when you empower the person to make that change. It is not that is being thrusted down on you. It is a change that you're making for your own self, which is good for you, and you realize it's good for you. And therefore, all the strategies, I think, whether it's around communication, whether it's around regulations, which is transparent labeling, all of that is going to only help the consumer finally make a choice that, yes, I'm making a healthier food choice for myself. And I think that is an important enabler of behavior change. So I think that's really well said. And I think if I have to summarize this in a minute, really, I think the key points that are coming out from today, we know that fortification is a very effective strategy. It has worked in other parts of the world. It will work in our part of the world as well. The other thing is about nutrition education, behavior change strategies. And I think we need to really brainstorm more as a industry group, etc., to see how do we do that. And also, therefore, the responsibility is both on the food industry, the policymakers and so on, to be able to make sure that you are creating healthier food products out there, and you are creating better labeling, etc., so consumers can actually make a healthier food choice. So I think these are in somewhat, and also, of course, one very important thing we also spoke about was really to say, how do you making a healthier food choice desirable is something which is a nice thing to do, and not something which is, I need to do it. And, it's not like, if I've made a healthy food choice, I know I've compromised on taste or I've compromised on something else. I think those are important things. And of course, the other aspect of it is to really look at, vehicles like fortification, you're supplying it through the midday meal schemes, etc., to ensure that those are very effective ways to kind of solve the problem more at a grassroots kind of level. So thank you everyone for joining in for today. And I think that was really a very good discussion, getting all your perspectives. I think I'd leave it open right now, Aina, for maybe if there are any questions that are coming up, if it's not already been asked.
I think, ma'am, most of the topics are covered and most of the questions in the chat box are answered. Just one thing people wanted to know actually, using millets right now is like as a source of nutrition has been discussed and has been promoted by the government of India as well. So what is the view on that?
Yeah. Would anybody want to take that question?
I'll go, ma'am. Millets, of course, are a very good source of nutrition, given the point that they are in themselves inherently a very good source of protein, vitamins, fibers. So that's the way. And as I see that the Prime Minister of India has also declared 2023 as the years of millet. And rightfully, it comes as a big responsibility for us as manufacturers. How do we really incorporate and really make products which are yet acceptable by the consumers? Because millets as a concept are very new for Indians, though we have been consuming it in certain parts of the country since a long time. But yes, to bridge and to break that monotony of certain staples being stabilized and bringing millets in, because they are inherently the rich source of certain nutrients, something which is very important.
Yeah, and I'd like to add to that. I think millets, one is it's nutritionally denser. It is, all of that, and also sustainability wise, it's a far more sustainable crop, right? The fact that you can get a lot of value added products. One is can you use millets to make nutrition more affordable? I think that is one, way to look at it. And the other way to look at it is also saying, can you be a millet capital of the world? Can we be, somebody who's producing a lot of the, nutritionally dense millet kind of products, which is then going out to the rest of the world? So I think there are multiple different benefits of using millets, and I think it's absolutely in the right path, Aina, to say that millets should be a very, very important part of what we do as we go along.
I just want to add that one of the best ways to have the benefits of millet every day is that we mix the millet flour with the regular wheat flour, because then it is an enriched flour. We can even add soya bean to it so that the protein value increases. So we have the amino acids from both soya bean as well as wheat, and we have millets, which are such a rich source of micronutrients. And so if we propagate the use of multigrain wheat flour using millets, it would be a good idea.
Right. So thank you so much, everyone, for joining in today and listening into some of the most wonderful speakers here. So thank you so much. And thanks all of you speakers and panelists for your fabulous inputs and for your valuable time. Thank you, everyone. Aina, over to you. If there's anything from your side you'd like to add on and end this session.
Yes, ma'am. I'm very pleased to see that our session went so well with all that intellectual exchange. And as our session comes to an end, I would like to take this opportunity to thank all of our dignitaries who shared their views with us today and helped us carry out this session in a very successful manner. First and foremost, I would like to thank our chief guest for the session, Ms. Sharma, for taking out a time of the busy schedule and addressing this discussion today. We are very humbled by your presence, ma'am, and we would like to thank you for sharing your experience and motivation to actualize the status of fortification and the improvement which inculcate to this path all along. Next, I would like to thank all our esteemed speakers. With such an eminence, they have expressed the ways to address the situation constructively as well as with concrete actions. As it is understandable that in sustainable development goals, the call to execute affirmative actions which can bring palpable results to widen the sustainability of all facets of life. The nutritional security to all is essential part of this, and in furthering of achieving and adopting better nutrition pathways for adolescents, we should really focus on sturdy policy framework, allowing the stakeholders to collaborate and provide deliverance from all limitations. I once again thank all our speakers for highlighting the ways to overcome the challenges, and as greater collaboration and cooperation both upstream and downstream will be required between various players of the value chain. Last but not the least, I would like to thank all the participants of this session for attending, and I hope that this session was very fruitful for everyone present today. Thank you, everyone.
Thanks
Thank
to Ms.
you.
Banerjee as well for moderating the session so well as well.
Thank you, Rinka ma'am, for
It was
moderating
Thank you
this.
so much
nicely
for this very
moderated.
wonderful
Thanks a lot.
session and very beautifully moderated, Rinki.
Yeah.
Thank you.
Thank you, ma'am.
Thanks. Bye-bye.
Bye-bye.